Take a look at this CT scan. The large, darkened area highlights the immediate neurological damage caused by an ischemic stroke, where a blocked blood vessel cuts off oxygen to the brain, severely impairing cognitive and motor functions. Surviving that acute medical event is only the beginning. Long after leaving the hospital, patients face immense physiological hurdles, specifically a drastic loss of motor control and the inability to maintain physical balance. As this diagram shows, out of the millions of stroke survivors, 1 in 3 experiences severe post-stroke depression. The sudden physical decline forces many individuals indoors, triggering intense social isolation. Traditional clinical rehabilitation is necessary to regain basic function, but pulling levers on a bed pulley day after day is highly repetitive. It keeps patients locked in a clinical environment that serves as a constant reminder of their newfound physical limits. Keeping a patient alive through the initial trauma solves the medical crisis, but if the resulting physical environment forces them to permanently retreat from active life, the recovery is incomplete. Now, look at the mechanics of a golf drive. To hit a ball with power, a player needs intense mental focus, precise spatial coordination, and extreme dynamic balance as their feet and hips twist through the swing. Those mechanics demand exactly what an ischemic stroke destroys: stability. Bilateral strengths and stroke charities are actively prescribing golf as a therapy tool. The sport forces survivors to directly confront and rebuild the specific deficits caused by their brain injury. The clinical link between this sport and neurological recovery traces back to a 1999 study out of the University of Chicago, which identified that the physical rigors of golf actively improve strength and flexibility for stroke patients. Executing a golf swing completely shifts the center of gravity, forcing weight transfer to a weakened side. To prevent falling, the core and joints must fire and stabilize during the follow-through. Practicing this sequence improves static and dynamic balance. Strip away the clubs and the fairway, and a golf swing is a highly complex, disguised exercise in neurological repair and motor control. Getting a stroke survivor safely onto a course requires dismantling the traditional rules and rigid structure of the game. Instead of standard irons, programs utilize specialized hardware. Patients with paralysis or severe balance issues use chair putters, clubs designed for a 0-degree swing, Velcro gloves for compromised grip, and automatic power tees so players never have to bend down. Because stroke recovery severely limits stamina, the physical layout changes too. Sessions are capped at 1 hour, driving ranges are outfitted with resting chairs, and players split their time working in pairs to manage fatigue. Clinical protocols are woven directly into the recreation. Registered nurses are stationed right on the driving range to conduct mini-assessments and monitor blood pressure before anyone takes a swing. By hacking the physical tools and the pacing, organizers turn a notoriously frustrating, physically demanding sport into a highly customizable vehicle for therapy. Moving rehabilitation out of a hospital ward and onto a driving range shifts the patient's internal narrative. Instead of focusing on what their body can no longer do in a clinic, they are outside, learning a new skill with an I-can-do mindset. The structure of the sport also mathematically levels the playing field. As this equation shows, the official golf handicap scoring system adjusts the final numbers, allowing a disabled survivor to compete equitably alongside an able-bodied player. Beyond the physical gameplay, the layout of a golf club forces socialization. Off-course areas like the clubhouse give survivors a natural venue to sit and talk with other people, navigating the exact same life-altering challenges. Rebuilding a patient's identity so they feel like an independent athlete rather than a lifelong patient is just as vital to their long-term survival as repairing their motor function. To facilitate recovery at scale, researchers proposed a 4-quadrant framework for disability golf. Top quadrants demand courses promote independence through alternative formats and accessible rest facilities. Bottom quadrants highlight how specialized equipment and adaptive carts carry restrictive costs, requiring flexible memberships. The current reality of the industry is stark. Researchers estimate that, optimistically, less than 30% of golf courses currently meet these basic physical and financial accessibility standards. We have a highly effective, proven medical therapy for a devastating neurological disease, but the commercial sports infrastructure required to deliver it is actively blocking its deployment. Golf offers a rare combination for stroke survivors. It demands the exact biomechanical movements needed to rewire the brain, while providing a built-in social network to combat isolation. As the population ages and the prevalence of mobility-limiting diseases increases, the wider sports and leisure industries have to adapt their facilities to accommodate players with physical limitations. Surviving a stroke does not end the day a patient is discharged from the hospital. True recovery is only achieved when the outside world is engineered to welcome them back.